Welcome to our webinar. My name is Rivka Ginsberg. I work for Lomit, one of the Kupot Cholim in Israel. And one of the things you will have to make a decision once you make Aliyah is which healthcare provider you choose for yourself or your family. And I'm here to talk about what the healthcare in Israel looks like, healthcare system, and how you make the decision of which kupa to choose. Kupa is like an HMO. I know you come from different countries. Every country has different, system of healthcare. It works differently. So I'm sure there's going to be some kind of an adjustment. But there's things you would want to find out, I believe, before you make Aliyah, especially if you have any pre-existing conditions, if there's young children, if you're planning to have any children in the future, all these things, or just, what are your benefits and how can you enjoy the benefits of Kupot Cholim here in Israel? So I'll just share a little
presentation.
Presentation. Israel's healthcare system. Okay, I work for Lomit. There's 4 different Kupot Cholim. I'm gonna name them by size. There's Klalit, the largest Kupat Cholim in Israel. Maccabi, the second. Meuchedet is the third, and we are the smallest kupa, which I see it as an advantage because there's more of a personal touch. There's always, someone will know you in the clinic. It's more personal as far as I see it. Okay, so the healthcare system in Israel happens to be a very good healthcare system. There's good coverage, and it seems like people in Israel are altogether happy with the healthcare that they're getting. Of course, you're going to hear different stories, but in general, it's a very good healthcare system, and you could be calm about making Aliyah. Obviously, you'll find out, about your personal needs, but in general, it's a good healthcare system. All 4 kupot give good services, and there's where to compare, and I'll tell you afterwards how you compare between the different kupot. But in general, all kupot give good service all over Israel. There's good coverage. The coverage is decided by the government. Every few years, they get together to decide which treatments, what medications. There's always new stuff coming up, and they get more advanced. They decide what they're adding to what's called the Sal HaBriut, the basket of healthcare, and all this is subsidized by Israel's government, and they decide about what the coverage will be. Now, everyone who's a citizen in Israel is entitled to get full healthcare services, no matter if there's pre-existing conditions, no matter how old the person is. If you make Aliyah and you're approved as an Israeli citizen, you're entitled immediately, the day you make Aliyah, for all the services and all the healthcare benefits that the Kupa offers. Okay. So there's, like I mentioned before, there's 4 different HMOs. They're called Kupot Cholim. And there's an option of switching between the kupot, meaning the idea is to keep some kind of competition between the 4 different HMOs in order to give better service, in order for us to try harder. And it's a competition, but really it's not a private kind of company or insurance. So we basically offer the same services. We just try to do it in a better way, so our patients, our clients will be happy. That's the idea of having competition between the 4 different HMOs, the 4 different kupot, and there's an option of switching between the kupot. Obviously, it's not something you would do every day, not every 2 months either, because this is your, you want to get to know your doctors, to know the staff in your clinics. But if for some reason you're unhappy with the services you're receiving in your kupa, you should know you have the option of switching. Okay, and once you switch, your benefits from the previous kupa will switch with you. Okay, so you don't lose out by switching kupot. Okay, now when the healthcare in Israel is covered through the government, basically you're paying taxes through your workplace, your salary, but you don't pay the kupa a monthly fee. It's free. So if you want, you have the option of adding on a supplementary insurance that the kupa adds, gives an option, but you don't have to. I do recommend to do it no matter what kupa you choose, because I'll tell you about the different benefits that the supplemental insurance offers you. And as new Olim, I know that in Leumit, we give benefits for new Olim immediately. Once you make Aliyah, you don't have any waiting periods to receive any benefits of the supplemental insurance that we offer. I believe other kupot are the same, but I'm not sure. So I'll just say that I know we give it immediately as new Olim. You have no waiting periods to get benefits in the supplemental insurance. So every kupa has 2 levels of supplemental insurance. Not very expensive. I don't know how much you're paying or not paying for your healthcare services monthly in the country that you're in right now. But the supplemental insurance in Israel is not very expensive. It depends on age. In Leumit, it starts from 24 shekels a month for children, goes up to around 160 shekels for adults, like the older, age group. So we're not talking about huge amounts of money, and it gives you a lot of benefits. What are the benefits that you can receive for the supplemental insurance? And I'll just call it Shaban. Shaban is what we call the supplemental insurance in Israel. It's a short for Shirutei Briut Nosafim, additional health services. Okay, so when I say Shaban, I'm talking about the supplemental insurance. Okay, so every kupa has 2 different levels of supplement Shaban. So Leumit, we call it silver and gold. Meuchedet, for instance, we'll call it Adif and Seed. Just different names. There's the basic, middle, and high level. Okay, basic is coverage through the government. And then the Shaban, you have 2 different levels. Obviously, they give different coverage, and the monthly cost depends on that too. If you choose the lower or higher level. Okay, so here are some examples of what kind of benefits you can receive from the supplemental insurance, from the Shaban. Okay, here, for instance, we offer in Leumit all kinds of supplementary, complementary medicine. We believe in, obviously the conventional medicine, which includes, your family doctor medications, different treatments, surgeries. But then in addition, you could use it for many different benefits. If it's, acupuncture, massage. I just went to a chiropractor today for 100 shekels. How much is that in your local? It's like really, really good coverage, and we use it all the time. It's great. And in Leumit, you're not limited in the amount of treatments that you could use it for complementary medicine. Okay, now we do try to have our patients live a healthy lifestyle. So we do subsidize exercise options. Some of it is through the supplemental insurance, some is free for anyone who has a higher BMI, and some options in different gyms are for just very low cost. The Kupa understands that the more you exercise and eat healthy, you're going to cost less for us, and you're going to just be healthier and happier. So the idea is to subsidize healthy lifestyle. So just for instance, through the Shaban, the gold, you can get a personal trainer who comes to your house, gives you an exercise personal session for only 23 shekels. It's amazing, amazing option. And I think I know a lot of people use this option, and then we do give discounts in different gyms all around the country for very low cost. You could go to different classes. gyms and just enjoy the exercise option. Okay. Another benefit, important benefit that you have with the Shaban is discounts on medications. Okay, so I started with saying that there's good coverage through the health basket, right? But sometimes there's a few different options for, let's say, medications, okay, for a certain medical issue. And there's a medication that's covered through the health basket, and then there's a medication that's not covered through the health basket, but might be a better option for you. And you would get a nice discount usually with a supplemental insurance. Instead of paying a full amount on that medication, you would get a discount. So that's important, and that's why I say it's important to have supplemental insurance, no matter what kupa you choose. You could manage without it. You're going to be fine, but I think it's important to have more options when it comes to your healthcare. Another benefit through the Shaban is private consultations with specialists. So the kupa offers specialists from all fields. Through the kupa, you pay 30-something shekels. It's really cheap, and you see good specialists through the kupa. But many times you would like to get a second opinion from someone who's known to be, the best. Or just before you do a surgery, you'd like to get a second opinion to make sure you're making the right decision for yourself. So people use this all the time. Basically, you have the option of going privately to specialists. With Leumit Gold, you get the option of going 3 times a year, calendarial year. If for instance, you would pay over 1,000 shekels to go to a private specialist, with Leumit Gold, you'd pay 200 shekels to with the supplemental insurance, and it's a very, very good and important option. Same goes to when it comes to surgeries. Many times, I mean, the kupa will probably cover any surgery that you would need, but you'll be sent to a public hospital, and you won't necessarily know who your surgeon will be. Many times you do have the option of choosing, but your choice is more limited. With a supplemental insurance, you have more of a choice for surgeons, and for a certain copay, you could go for private surgery. So I think the main benefits that are really, really important for the Shaban is medications, second opinions, and surgeries. All the rest is very nice. It's great. You get discounts. You could go, exercise. You could have massage, but the real things that you would like to have higher coverage is the choice of surgeries or second opinion.
מדברים גם על הנושא של השיניים, שזה...
Okay, so Ella, who also works in Leumit, hi Ella. Toby's here too. So I mentioned the dental care. Okay, so dental care is not covered through the health basket for adults from the age of 18 and until the age of, I think it's 70 or 75. I do not remember. So there's dental coverage for children, and over 70 or 75, I could look it up afterwards. So in between those years, dental care is private, and we offer through the supplemental insurance discounts on major discounts on dental care. It's in Leumit, we work with private dental care, dental clinics all over the country. And it's significantly less expensive going through the kupa. Okay, now another thing is for all the women here or anyone who's planning pregnancy in the future, or if you're coming already expecting, there's lots of benefits for pregnancy and birth. It's called the birth basket and pregnancy basket. It gives so many options. You have the option of taking a private doula to go to an afterbirth hotel and get reimbursed. You can get consultations with a personal trainer, with a nutritionist. There's different tests that are not covered through the health basket for pregnancy because there's endless options for pregnancy testing. And if you want more extensive testing, you have the option of doing it through the expanded birth and pregnancy basket. Okay, so
Rivka, you have
yes,
two questions. You have two questions from Shlomo. Can you choose
yes.
a specialist or is there a list?
So if we're talking about Kupa specialist, okay, you can, not all kupot are very flexible. I know that Lomit is flexible. You could go to any specialist that works in the Kupa, any specialist of your choice, and of the list of specialists that work in the Kupa that you chose, okay? This, in our Kupa specifically, I know we're very easy about you going. If you live in Tel Aviv and you want to go to a specialist in Yerushalayim, you're more than welcome to. Not sure that all kupot are that flexible. Definitely Lomit is. And if you've seen one specialist, you can switch between specialists in the same field within a quarter of the year. So if you've seen, let's say, a specialist on March, you could see another specialist of that field on April. But if you've seen on January, you'll have to wait till April to see another specialist in the same field, okay? But there is the option of choosing to see private specialists through the supplemental insurance, like I mentioned before, from a very, very large list of specialists that work with us and with other kupot, and then it's through their private clinics. Okay.
Perfect. And the second question from Clifford, how much is a supplementary?
Okay, so I was going to talk about that soon. It really depends on age, and this is something that you could compare between the different kupot. Every kupa has their price list according to age. Leumit happens to be a little less expensive than the other kupot, especially for the younger group. So it's worth doing some homework and comparing between the different kupot, how much the supplemental insurance comes out to be. It could come out to be a difference of a few hundred shekels a year, or even close to 1,000 shekels a year for a family. So this is something that you should check out, okay? And obviously you could turn to me afterwards. I'll give you my email, my WhatsApp number, and I could tell you the different prices, okay? Okay, so low meat, I'm talking about low meat, but this, every kupa has clinics spread all over the country. We personally have over 720,000 customers in Israel. We're a small country, so that's a nice amount. For our customers, we have more, since I made this presentation, we grew. Okay, so we have more than 350 branches nationwide, up north, down to Eilat. We have many different clinics. We have over 3,000 employees and over 2,000 specialist doctors countrywide. Okay, we run laboratories in most of our clinics. So lab work you could do in the clinic that's close to your house. Most clinics have family doctors, pediatricians, and gynecologists. Those are the basic, and a nurse, obviously. Those are basic healthcare needs for the family. So the way it works is the Kupa has clinics within the community, okay, in the different neighborhoods in the different cities, and we collaborate with hospitals countrywide, different hospitals. Leumit works with, I think, almost all hospitals in Israel. So you have many different options for the kupa when they would refer you. The way it works is, let's say someone goes to a specialist in the kupa and they need some kind of procedure done. The kupa would refer you to a hospital that works with the kupa and would give you what's called, okay, you don't have to know this word. It's called hitchayvut. Basically a form that says we're going to cover the cost of whatever hospitalization or procedure, whatever it is that the kupa sends you to the hospital. Okay, we have call center. This is our number, *507. Every kupa has a different number and call centers nationwide. We have English speaking representatives in our call center. And we have the option of calling and making appointments, finding out the different options through the call center. Okay. Now we offer also online services, both on an app, on your phone app, and on a website. There's so many options. You could use the app and website for the online services. It's just so easy, so simple. It's simple, but not simple, because the only downside to it, it's in Hebrew. But I actually would be happy to do like a little presentation of the app in the future, if anyone is interested, of how to use it exactly. But there's so many options, so user-friendly. You can make appointments, you could see your lab work results, you could go into your medical files, you could order medications to your house for very low cost. You could be in touch with your doctor, write to your doctor, send a picture of the rash that you have on your arm and ask the doctor, do you think I should come in, or can you prescribe me medication for this instead of coming into the clinic? You could have telemedicine appointments. So many options on the online, makes life so much easier. I know some people a certain age, it's not so easy to get used to these things, but try, because it will make your life so much easier. It's amazing. We have the option of online pediatrician 24 hours a day. This is for consultation. Something comes up in the middle of the night. You could just call our call center. There's a pediatrician, and there's another option there's the Taito machine that you can actually, with the doctor online, check for ear infections, throat. It does everything. It's like a little gadget that checks different for the children, and the doctor receives all the information from this little Taito gadget. So this you could do online. Sorry. Sorry. So we spoke about the app. And the same services that we have on the app, you have also on the website. And I did not mention in the beginning, Ella is here and Toby is here. Ella and Toby speak both Hebrew and English. I'm the English representative. And it's important before you make Aliyah. Okay, this is not in the presentation. This is my information. You could take down my phone number, my email address, and be in touch with me. But let me speak about what to make sure to have ready before you make Aliyah. Okay, so you have my phone number here, my email address too. This is I'm sure you have questions, personal questions about coverage for yourself. If you have pre-existing conditions, is the medication that you're taking covered in Israel? How much would it cost? Is there a clinic close to my house? Okay, all these things you would probably want to find out before making Aliyah. Okay, so what are the things you should find out before making Aliyah? Okay, first of all, to ask around. Where are you planning to live? Okay, so according to the place you're planning to live, you find out what medical services are offered in the area. Some, let's say, some communities you would have 2 kupot, and it's chaval for you to sign up for a kupa that will not be close to your house. So ask around people who you know in the neighborhood that you're planning to move to, what kupa is recommended in your area. You want to know if there's doctors who speak your language. Making Aliyah is a process. I won't say it's not easy. Okay, it's not easy. You need people who speak your language to help you get through this. And when it comes to your medical needs, even more so, because you want to know that the person who's taking care of you understands you and communicates well with you. So you want to find out if there's a clinic close to your house, if there's someone who speaks your language, if you have any questions, if you have someone to turn to in the kupa to help you with dealing with stuff, where to go, what to do, and in general, if people are happy with the services in the kupa that is close to your house. And if it's not so close but people are happy, maybe it's worth signing to a kupa that's not close to your house. Okay, this is homework you will have to do before making Aliyah. So if you're taking regular medication, if you have children who need, child development services, who might need child development services, okay? If you're pregnant and you want to know how it works in terms of birth here in Israel, all these things, you could contact us before making Aliyah to find out, to get more specific information for your needs. I would recommend, okay, to have your medical files on a hard like have it both printed out and both on a file before you make Aliyah, because sometimes we would need previous records to approve medications, to approve different treatments. Very, very important to have all your medical files when you make Aliyah, okay? If you are taking regular medication, I highly recommend to have a stack of at least 3 months in advance when you come, okay? Because sometimes it takes, some medications need approval till you get to the doctor, till you get it approved. You should have your medication for at least 3 months when you make Aliyah, okay? And of course, contact me or whoever it is that speaks your language to find out if your medication is covered here. If not, what are the other options for your specific needs? We might have a similar medication, has a different name. Maybe it comes in different dosages here. All these things, just for you to be calm before you make Aliyah, you could be in touch with us and find out this information. So those are the main things I would find out and take care of before you make Aliyah. Now, are there any questions, Leon?
Just put your phone number on the chat, okay?
Okay. It was in
You have several questions on the chat. You responded to some of them.
You responded all of them, not? בוא נראה רגע. I've heard that Israeli citizens can receive medical assistance abroad according to the Israeli standards. דיברנו על זה לא?
על מה?
רגע, Israeli citizens can receive medical assistance abroad.
So, this is not covered through the health basket, meaning if you go abroad and you need medical care, so there's options of taking a private insurance, tourist insurance, basically, before you leave. The kupot offer this option, this additional option for low cost, but it's an additional option and it's not covered by the health basket. It will not give you the same coverage as you would get through the kupa. It would give a certain coverage with a copay, like any private insurance. And also I did not mention another thing. There's so we talked about the supplemental insurance. There's also what's called the bituach siudi. Sorry, English is not my first language. If someone becomes a disability insurance, okay? If someone chas v'chalila, becomes disabled, and they have the disability insurance, they get, of course, there's different criteria as to what the disability means. It's severe disability. So they get a certain amount per month towards care, and or towards hospitalization and different facilities. And this does have to do with pre-existing conditions, meaning it's not like joining Kupat Cholim, where anyone can join any kupa and they have full coverage of what the kupa offers. When it comes to disability insurance, you could only join, I think, till the age of 60 or 65. I'm not sure the exact age. And you would have to fill out a questionnaire to see if you're eligible to join this insurance. Price obviously changes with age, so the younger you are, the lower the cost is. But this is another option to look into. Okay.
How quickly after repatriation can I get my wife also repatriate? Maximum insurance in the health insurance fund.
Immediately.
Immediately. אין תקופת המתנה.
Yeah. As new Olim, you get all your benefits immediately. When you make Aliyah, you declare what kupa you want to join. Within a day or two, you should be in the system already. You can make appointments, come in, take care of your supplemental insurance, bring your Teudat Oleh, update whatever information, phone number, address, whatever it is, and you're good to go. Any other questions?
How much time should pass after repatriation to apply for the IVF program and the health insurance fund? Immediately. Same.
Yeah. No waiting. So easy.
Wow, it's
Just
a
make Aliyah.
long question. Okay, just one moment.
No one asked here, but I don't know. Some people have different statuses. Some people might be, katin chozer, meaning that their parents are Israeli, made yerida, and they're coming back. You would like to check out your status with Bituach Leumi, because that might take a few more days to join Kupat Cholim. But anyone who's making Aliyah, first time national and like citizenship, should be pretty clear and easy.
Mila is asking, do I understand it correctly that doctors or clinics are connected to one insurance to one insurance company only?
Yes and no. So every kupa has the doctors that work for them. If it's family doctor, pediatricians, usually they work for one kupa. But when it comes to specialists, many specialists work for a few different kupot, because they're not there on a daily basis in every kupa. So they would go, they would work in different kupot. So when it comes to family doctors, pediatricians, usually just for the one kupa that you're in. Specialists might work in several kupot. And of course, the private specialists that I mentioned through the supplemental insurance, they're private, so they don't work as part of a kupa. They work in they might work also in a certain kupa, but they work in their private clinics, and you could choose to go to them privately.
Okay.
Any other questions?
There were a question related to your application. Is it only in Hebrew or also in English?
To apply for a Kupat Cholim?
No,
The application
on the mobile.
The app.
It's in
The app.
the app.
The app is in Hebrew. Okay. This is right for all kupot. I mean, all kupot, the apps are in Hebrew. But I know Lumit app is very user friendly. You see, like you have like different icons to kind of figure out what it's for. You play around with it a little bit, and I believe you'll figure it out. If you don't, I'll try to help you personally.
I'm gonna add that in the app you can go inside the chat with the doctor, and write to your doctor in English. If you know
This is actually something.
if
This is actually something that not all kupot allow. Leumit allows you to write in English to your doctors. Some kupot do not give you the option. They want you to write only in Hebrew. So that's a big plus for English speakers.
As you know your doctor, you can write him and he will answer you in English.
Perfect. So Rivka, I think you responded to all the questions that was written on the chat. Thank you very much. Is
Any
there
other questions you
additional
can write
question?
down.
Thank you very much.
I'll
Also,
just,
over here you can see our phones. You can also call to us. But put before +972 and then a phone, okay? It's a code of Israel.
Perfect.
And we would like to help you wherever you want, wherever you need. You can call to us and ask question to Rivka, to Toby. My name is Toby, and to Ella.
Ella too. I just want to say that all of you that are thinking of making Aliyah, or you're already in the process of making Aliyah, when it comes to your healthcare, you could be calm. You're coming to a good place. And it's amazing. I wish you all an easy journey. This should be the best move you make in your life. I believe it's the right place for all you Jews. You're gonna be so happy, and hopefully, it could take time, but you'll find your home here. And we're looking forward to be in touch with you and see you here in Israel, and to wish you mazal tov when you make Aliyah, and hopefully to go smoothly and easily. And just welcome.